أعوذ بالله من الشيطان الرجيم. لله ما في السماوات وما في الأرض، وإن تبدوا ما في أنفسكم أو تخفوه يحاسبكم به الله، فيغفر لمن يشاء ويعذب من يشاء، والله على كل شيء قدير. آمن الرسول بما أنزل إليه من ربه والمؤمنون كل آمن بالله وملائكته وكتبه ورسله لا نفرق بين أحد من رسله، وقالوا سمعنا وأطعنا غفرانك ربنا وإليك المصير. لا يكلف الله نفسا إلا وسعها، لها ما كسبت وعليها ما اكتسبت. ربنا لا تؤاخذنا إن نسينا أو أخطأنا، ربنا ولا تحمل علينا إصرا كما حملته على الذين من قبلنا، ربنا ولا تحملنا ما لا طاقة لنا به، واعف عنا واغفر لنا وارحمنا، أنت مولانا فانصرنا على القوم الكافرين. صدق الله العظيم. بسم الله الرحمن الرحيم. إن الحمد لله نحمده ونستعينه ونستغفر عليه، ونعوذ بالله من شرور أنفسنا ومن سيئات أعمالنا، وأشهد أن لا إله إلا الله وحده لا شريك له، وأشهد أن محمدا عبده ورسوله. السلام عليكم ورحمة الله وبركاته. Severe acute respiratory syndrome, coronavirus 2, better known as COVID-19, is real. But unfortunately there are some among us who still do not believe this. My name is Ridhaa, and I'm a junior medical doctor, having just completed the first of my internship years based in the largest township in Cape Town. I'm often asked the question, what was it like going through a global pandemic in your very first year as a qualified doctor? Honestly, it's been challenging to say the least, but I can't imagine how challenging it must be to those who have lost their jobs because of this pandemic, and I can only be grateful to have a job during this time. I remember back to the first week of March 2020, sitting in the tea room at work, no masks, less than 1.5 meters from each other, enjoying lunch together, laughing about how people are panicking about this COVID-19 that will most likely only be a flu that will pass quickly. Little did we know that we would be fighting through what is now our second wave of infections, surpassing the dreaded 1 million cases, and having over 25,000 people succumbing to the illness in South Africa by the end of the year. While the rest of the country's economy slowly shut down to flatten the curve, we continued along with our normal working lives. While fellow South Africans complained of how bored they were at home, we longed for even a few days off from work to rest. We watched in horror as healthcare workers in other countries had to deal with overcrowded hospitals, lack of beds, shortage of staff to care for the patients, not enough oxygen, and stories of patients dying in the corridors while there was nothing the doctors could do about it. Listening to what I've just said, it sounds all too familiar to what we are experiencing now, here in South Africa. Our hospitals are filled beyond capacity. Our emergency centers are overflowing, patients sitting on chairs for days on end. Our healthcare workers are doing extra shifts to cover for those who are off work, as they are either taking leave for the very first time in the year, or they're infected with COVID-19 themselves, or they are just exhausted and need a break. We are all tired, but this talk is not about us seeking sympathy from everyone. I'd like to share a story of an interaction that I had with a patient's family last week. Some of you may have read about it already, but I believe it is important to share due to how frequent this is becoming and how we can learn from it. I was on night duty last week and was called by the nurses to the ward to break the sad news to these people that their family member, a 65-year-old man, had just died after testing positive for COVID-19. He presented to hospital the night before, needing oxygen support, and less than 24 hours later, he had passed away. But unfortunately, the story doesn't end there for this family. About this man who passed away, in early October, his wife passed away, COVID positive. In late October, his eldest son passed away, COVID positive. In early December, his youngest son also passed away and also COVID positive. And he now presented to the hospital with his middle son, both COVID positive and both requiring oxygen support. Now, this son is the only member of the household left behind. I called the father's daughter-in-law into hospital, the wife of the eldest son, who also passed away, to break the news, and she brought his two younger sisters along with her. After they overcame the initial wave of grief, they shared with me that they had just held a memorial service for the youngest son earlier that very same day. Can you even begin to imagine what they have been through? After the family left, I found out from a colleague that the middle son of this man is actually laying in a bed in the exact same ward as his father, just in a different room. However, due to his own condition and the hospital protocols, he couldn't even go to the next room to greet his father one last time. And the most heartbreaking moment was telling him the news and seeing him look at me with a surprisingly blank expression and looking utterly defeated, and hearing him say, "So I'm the last one left." It pains me to say that this is only one of hundreds of similar stories where entire families have been wiped out from COVID infections. I was asked an interesting question by one of the nurses the other day. She asked, "Doctor, why don't you get angry with the patients who have COVID? Because clearly they didn't follow the health protocols if they are getting infected." Some would answer, yes, we must reprimand them, for it's clearly their fault that they contracted COVID. But I believe that this approach will only lead to feelings of guilt and blame instead of helping heal. They are now infected. There's nothing anyone can do to take that back, or to bring back their loved ones who have passed away. All we can do, and all we should be focusing on, is preventing more people from contracting the virus. For the rest of it, Allahu A'lam, Allah knows best. While we enter into this new year, let us make the niyyah, the intention to be better, to do better, not only for ourselves, but for our families, friends, and broader community. And as per our President's request, I hope you lit a candle last night at midnight. And if you didn't, light one tonight, and every night for the next 3 nights. Let us make these first days of 2021 days of prayer, reflection, remembrance, and learning. We make dua for all those who have lost their lives to COVID. May Allah grant them Jannatul Firdaus, inshallah. We make dua for the families of those who have passed on. May Allah make it easy for them in this time of mourning. We make dua for all those who are infected with COVID, be they in hospital or at home. May Allah grant them shifa, healing, and access to the necessary equipment to heal them. We make dua for all our essential workers, hospital staff, healthcare workers, law enforcement officers, petrol attendants, and so many others who have worked tirelessly throughout the pandemic. May Allah make their work easy and spare them from the burnout and mental exhaustion so many are experiencing. And lastly, we make dua for everyone else, our mothers, our fathers, our friends, colleagues, neighbors, everyone. May Allah grant them the strength to make the right decisions and to follow the guidelines set out by the national authorities. Allah subhanahu wa ta'ala states in the Holy Quran, in Surah Al-Baqarah, chapter 2, verse 286, one of the most well-known verses. Bismillah ar-Rahman ar-Rahim. لا يكلف الله نفسا إلا وسعها. God does not burden a soul with more than it can bear. Sadaqallah al-Azim. Let us use this to strengthen our belief that we will get through this, but only as long as we work together. For months, the nation referred to us healthcare workers as being on the front line. But given the stories I have shared with you and the current state of our healthcare system, it's clear that we are no longer on the front lines, but rather we are the back line, the last line of defense. You, the people of South Africa, are the front line. Protect yourself, to protect your family, to protect us, but most importantly, to protect humanity. Protect them, because you are the front line now. Inna Allaha wa malaikatahu yusalluna ala nabi. Ya ayyuha alladhina amanu yusallu alayhi wa sallimu taslima. Subhana rabbika rabbil izzati amma yasifun. Wa salamun ala al-mursaleen. Walhamdulillahi rabbil alameen.
Bismillahir Rahmanir Rahim. Allahumma Rabbin Nas Azhibil Ba's Washfi Anta Shafi La Shifaa Illa Shifaa'uk شفاء لا يغادر سقما اشف مرضانا نسألك اللهم أن تشفيهم من هذا الوباء كرونا اللهم آنس قلوبهم بنور وجهك الكريم اشف أجسامنا وأنفسنا بحبك ورحمتك، وأن نتوكل دائما على رحمتك الواسعة. والحمد لله رب العالمين.